The absolute best part of being a doctor is taking somebody that is miserable in their life. They have pain on a daily basis, or they can't enjoy their life. They can't enjoy their daily activities, even walking to the bathroom sometimes. Taking that patient and performing a procedure or a surgery where it is absolutely life-changing and earth-shattering for them in such that it restores their function, restores their capacity to do the simple activities of life. I think a good example of that would be, say somebody's in a car accident and they've broken their hip and shattered their hip, and I get involved in that care and have to treat the broken hip. And in the course of that treatment, there are times that maybe the fracture doesn't heal, or the patient's still having issues or having pain, and sometimes the x-rays don't even show an abnormality. And it really takes a lot to stay with that patient and talk them through some of the issues they're having, and in a stepwise fashion find out exactly what's going on. And the best part is when you can actually find the small issue that is not evident or not immediately noticeable on the x-ray, and adjust that or fix that issue. And it's life-changing. I broke my wrist playing basketball when I was 6. And I remember to this day Dr. John Paul, and I understand he's still practicing to this day. He's got to be in his late 70s. But he set my wrist, and from that moment, I've always told my parents that that's what I wanted to do. And it was funny, when I was moving from my residency to start my own practice in Cambridge, I was moving some old journals and old paperwork and schoolwork, and my mom had saved a journal that I wrote when I was 11 years old. And in that the first entry in that journal was, when I grow up, I want to be an orthopedic surgeon and treat sprains, strains, and fractures. I'm very casual. I like to discuss patients' lives. I want to know what their background is. I want to know where they came from, what their daily routine is, because that helps me treat them and ultimately return them to those things that they enjoy if they're not able to do them. Orthopedics has changed dramatically since I've started practice 10 years ago. Even before my practice, if you had a knee replacement or a hip replacement, you were in the hospital for 7 days before you had the surgery, and then you stayed in the hospital for several weeks afterwards. And the technology and the thought process and how we treat patients has changed dramatically, to the point where some people are having a hip replacement or knee replacement and going home the same day. I would say the most memorable patient and the most memorable experience that I've had in terms of having an extremely successful outcome is I had a patient that was 100% wheelchair bound. Both knees were bad, both hips were bad, and in the course of about 2 years, she walked into my office pain-free, walking with her family, walking with her husband on a daily basis for exercise, and I completely turned her life around by replacing all 4 of her joints. And albeit that's not something that happened quickly, but it was so devastating for her to be wheelchair bound at such a young age that is something that I'll never forget. So if you're having hip pain or knee pain and it's affecting your life, where you can't do the things that you enjoy, whether it be basketball, whether it be racquetball, or just even walking to the mall or walking in the grocery store, you need to come see me or see one of my partners, because oftentimes it's something that we can fix and alleviate in order for you to return back to your normal life.